So now let's walk through the last of our formed elements, which are platelets. And remember, platelets are not considered complete cells. The only complete cell in our blood are white blood cells. They have a nucleus in them. Platelets are actually just tiny little fragments of a bigger cell called a megakaryocyte. And if we break that word down, we know that mega means big. Kary means nut or nucleus, and we know that cyte means cell. So literally megakaryocyte means big nucleus cell. So platelets are just little fragments off of that cell. And if you look at the image here on the bottom, you can see that we've started with this large hematopoietic stem cell. Remember, it doesn't know which of the formed elements it's going to be yet. And it differentiates into something called a megakaryoblast. That's a big cell that gives rise to that megakaryocyte. And you can see here, these little fragments are actually coming off of that megakaryocyte, and that is what our platelets are composed of. Now, if we look at a platelet, the outer region of that platelet stains blue, and inside it has all these purple granules. The little purple granules contain the blood clotting chemicals. A normal number of platelets in the human body is between 150,000 and 400,000. So what is the role of your platelets? Now, they are necessary for blood clotting. So they form what we call a temporary little plug that will seal any break in a blood vessel. So their job is to sort of seal over your blood vessel, almost like a Band-Aid, and help you not lose too much blood too quickly. Now, platelets age very quickly. Usually they degenerate within about 10 days if they're not involved in blood clotting. And they are regulated by a hormone called thrombopoietin. Okay, so we've talked about all of the hormones that help to control your formed elements and the production of those formed elements, right? So remember, red blood cells, it's erythropoietin that helps you produce red blood cells. Remember, erythropoietin is made in the kidneys. White blood cells is colony stimulating factors and interleukins, and platelets, it's thrombopoietin. Now, again, I already mentioned to you that platelets are basically little fragments of a megakaryocyte. So they're just little fragments of that cell. They are not complete cells. Let's talk a little bit about this term hemostasis, not to be confused with homeostasis. Heme means blood, and stasis means halting or stopping. So hemostasis is the reactions that have to happen in order to get your blood to stop, so that you're not leaking fluid out of your blood vessels. And these reactions, there's about 30 reactions involved in hemostasis, and they are very fast. So these are a fast series of reactions. These reactions require clotting factors and other substances that are released by platelets. There's some chemicals released by platelets and even by injured tissues. They're releasing chemicals that are telling the platelets where to go. So there's 3 steps involved in hemostasis that I'm going to walk you through, 3 big steps. The first one is a vascular spasm. So when a blood vessel is torn, the first thing that's going to happen is that vessel is going to constrict. It's going to get smaller. And I want you to think about why that would happen. If the vessel constricts, it is restricting the amount of blood flow that can move through that vessel. Therefore, it's going to restrict the amount of blood that is lost. So this is a protective mechanism. Okay, so vascular spasm happens first. Next thing that will happen is, based on all these chemicals that are being released by the injured blood vessel, chemicals being released by platelets, a platelet plug will start to form in that vessel that's been damaged. And then lastly, the third step is blood clotting. So I want to go through each of those 3 steps in a little more detail. Let's start with vascular spasm. So I mentioned to you that when a blood vessel is damaged or torn, the first thing it's going to do is constrict. This is going to basically restrict blood flow through that vessel. And what's going to trigger it to constrict is any direct injury to the smooth muscle of that blood vessel. Also, chemicals that are released by the endothelial cells and the platelets in that area are going to cause it to constrict and get smaller. Now, that term endothelium, we talked about epithelial tissue in Anatomy 1, how it's a covering or a lining. When it's on the surface of your body, we call it epithelial tissue, but when it's lining something inside your body, like when it's lining your GI tract or lining your blood vessels, we call it endothelium so that you know it's inside the body. Okay, so endothelial cells are just the cells making up that lining, that tissue inside a vessel. And then also another trigger that would cause the vessel to constrict and spasm is the pain reflex. So when a vessel is torn, there's going to be some pain associated with that, and the vessel will constrict. Now, I will tell you that vascular spasm can be really effective at shunting blood flow so that you don't lose too much blood, but it's really effective in just the smaller blood vessels. It is not going to be incredibly effective if we're talking about a really large vessel or even a vessel that is large with a lot of pressure behind it, like an artery. If an artery has been damaged, there's so much pressure behind the blood in an artery that someone can bleed out really quickly. So vascular spasms aren't going to help much with that. They're much more beneficial in veins and smaller vessels. Now, the second step I told you is the platelet plug formation. So normally platelets are sticky, and normally though, they're not going to stick to an undamaged endothelial lining inside of a vessel. Normally it's nice and smooth, the platelets just roll right through. But whenever the endothelium inside of a vessel is damaged, collagen fibers poke out. So remember from Anatomy 1, collagen fibers are stronger than steel. So these are really tough fibers. And what's going to happen is it's going to make the lining inside that vessel a little more rough if those fibers are sticking out. So platelets will stick to those collagen fibers using a plasma protein called the von Willebrand factor. Once they stick, they're going to swell up. They're going to become even more sticky, and they're going to release more chemicals. And those chemicals are going to call for more platelets to come to the area. Those platelets will swell up, get more sticky, release more chemicals, and it will call more platelets. So this process continues. Now remember, that process is positive feedback. So more and more platelets mean more and more chemicals getting released to call for more and more platelets. Usually a platelet plug will form in under a minute, so it's pretty fast. Now, depending on the size of the wound, the size of the break in the vessel, it may need additional reinforcements of a blood clot. And so that is our last step. That's our third step, coagulation. The blood clot forms to help reinforce the platelet plug, and it reinforces it with fibrin threads. So fibrin, if you remember, is a protein that we find in our blood. It's a soluble protein. It is not used in any kind of cell respiration or any other metabolic process. It is found in the blood and it stays in the blood. And fibrin, just like its name sounds, it actually forms fibers. So it's normally a soluble protein, but under the right conditions, it will turn into these fibers, almost like a spider web that can help to form a blood clot. And it truly is going to change the consistency of the blood from more of a liquid to more of a gel. And so in order to form fibrin threads, there are a series of reactions. And I mentioned this a couple slides ago. These reactions happen very fast and they require clotting factors. Sometimes we also call these procoagulants. Our clotting factors are typically numbered. They're numbered 1 through 13, and they're actually numbered in the order of their discovery. So they're not necessarily numbered in the order that they're used in those 30 reactions. You don't need to remember when they're used. You don't have to memorize all these reactions. You just need to know that they're numbered. In order to make clotting factors, you have to have a good supply of vitamin K. You also have to have a good supply of calcium as well. Remember, we need calcium for everything. Now, I mentioned in order to create this fibrin spiderweb mesh, you have to go through about 30 different reactions. And it's really complicated. And your body makes it complicated for a reason. You don't want your blood to clot in an undamaged vessel, because that would just create a blood clot that would be essentially a ticking time bomb. If it were to detach and move throughout the body, we call that an embolism, and it can go to the brain, it can go to the heart, it can go to the lungs, and usually people don't recover from that. So we don't want our blood to clot unless we really need it to clot. So that's why the reactions are a little complicated, and that's why there's so many. So here's a chart from your textbook that walks you through those 13 clotting factors. They have a number name, which you can see over here, and then they also have a factor name. You don't need to know any of that. You don't need to remember any of that for our purposes. What I want you to know is that the whole goal of blood clotting is to produce fibrin. It's to convert fibrinogen to fibrin. That's the whole point of these 30 reactions at the very end, is to make fibrin. And I mentioned that fibrin is like a fiber. It's almost like the spider web mesh type substance. So you can see in this image down here, it almost looks like a tan or brown loose knit sweater. That's the fibrin that's formed. It looks like a little spider web, and you can see all those red blood cells are getting trapped in it. And this is how the blood is going to change consistency from more of a liquid to, when we trap all these red blood cells in that one area, it becomes almost jelly-like. So I'm sure that you have seen a blood clot before. You notice that it is almost like jello. So this image is a great image. This shows you those 3 steps. So it shows you right here, you can see that that vessel has been damaged, it's torn. First thing that happens is the vessel constricts, it spasms, and that's what all of these black arrows are trying to show you, that vessel constricting. And then you can see step 2, those platelets are going to stick now to the endothelial lining, which is now rough. It's no longer smooth. It's been damaged. So the platelets stick, they swell up, and they release chemicals. Those chemicals call for more and more platelets to stick to the area until eventually that wound has been sealed with a platelet plug. So that's the platelet plug formation. Again, this is positive feedback. More and more platelets until eventually you seal over that area. And then depending on how large the wound is, the platelet plug has to be reinforced with a blood clot. And that is step 3, coagulation. So I would like to walk you through blood clotting. Let's walk through coagulation. And I told you this is a series of about 30 reactions that happen in a cascade. Basically, one protein is converted to an enzyme, which converts another protein to an enzyme, and it keeps going through 30 different reactions. Each reaction depends on the product of the preceding reaction. Again, this is a mechanism to prevent your body from creating clots in an undamaged vessel. So do you need to know all 30 reactions in forming a blood clot? You do not. You basically need to know these 3 phases of forming a blood clot. And so in phase 1, this is by far the longest series of reactions. And at the end of phase 1, prothrombin activator is formed. In phase 2, there's a series of reactions where we convert prothrombin to thrombin. And then in phase 3, fibrinogen gets converted into fibrin. So remember a couple slides ago, I told you the whole goal of blood clotting is to convert fibrinogen into fibrin. So it's basically phase 3, that's the whole point. But we can't get to that unless we do phase 1 and 2. So this is an image that is showing you phase 1 of blood clotting. So you can actually see all of these different clotting factors. Again, they're named by a number in order of discovery. You can see calcium is being used here in this process. And so all of these clotting factors are used throughout these different chemical reactions. And you can see at the end, I've circled in red, we create prothrombin activator. So again, in order to create that, we have to have gone through those reactions. We must have clotting factors, and we have to have calcium for that to happen. Now, once prothrombin activator has been formed, usually a blood clot will then form within about 10 to 15 seconds. So that means that phase 2 and phase 3 happen very quickly. Phase 2 converts prothrombin to thrombin. And then you can see here in phase 3, fibrinogen gets converted into that fibrin, that mesh. So those are sort of the 3 phases of blood clotting. Again, the whole point is to convert fibrinogen to fibrin and make that clot. Now, a couple of terms, some I've used, some I haven't used yet. One term is coagulation. The term coagulation means to clot. A procoagulant, if you are pro, that means you are for something. So a procoagulant is going to help with blood clotting. So these would be things like clotting factors, anything that will enhance clot formation. An anticoagulant, anti means against. So an anticoagulant would be anything that inhibits blood clotting. Right? So I want you to think about maybe some anticoagulant medications that you may have heard of. Things like aspirin, that's an anticoagulant, right? Heparin, warfarin, Coumadin, these are all anticoagulants. They prevent your blood from clotting. In order for your blood to clot, the number of clotting factors have to outweigh the number of anticoagulants. So again, this is why people might take medications, anticoagulants like aspirin or warfarin, because increasing the number of anticoagulants in the blood means you're not going to clot your blood. So this might be a type of medication that someone is given after a heart attack, for example. They don't want your blood to clot. After any kind of like joint replacements, like knee replacements and shoulder and hip replacements, they'll give you anticoagulants. They don't want your blood to clot. So a lot of times after major surgeries, you'll be on these types of medications. You don't want to be on anticoagulants before you have surgery. Because the minute a surgeon cuts you open, they won't be able to control the bleeding. Okay, so if you're on anticoagulants and you know you have to have surgery, a lot of times they'll say, don't take them for a week before the procedure. Okay. Now this term clot retraction, this just means that the clot becomes stabilized. So clot retraction means the clot gets stabilized. Usually what we'll find is that platelets have little contractile proteins like actin and myosin. Now those should sound familiar. Those are the same thing we find in our skeletal muscles, right? Actin and myosin, contractile proteins. And they will contract within about 30 to 60 minutes. The contraction is actually going to pull on the fibrin, that mesh that's clogging up those red blood cells. And it's actually going to help to squeeze the serum out of the clot. And it's also going to help to draw the edges of the damaged red bloods or the damaged blood vessel together. Now, vessel healing will happen as clot retraction occurs. So as everything's getting pulled together, as the edges of that damaged vessel get pulled together, as the fibrin contracts and squeezes out the serum and makes that clot a little bit more stable, all of that is helping with vessel repair. Vessel repair is also aided by something called platelet-derived growth factor. Now, for short, PDGF, platelet-derived growth factor. Just think about the term. It's a growth factor, which helps speed up mitosis, and it's derived from the platelets. So this is a chemical that the platelets will release, okay, that help with mitosis. This is going to help heal the vessel wall. The cells in that blood vessel are going to go through mitosis faster in the presence of this growth factor. And it's going to help to seal the edges and bring those edges together. There's also a growth factor called vascular endothelial growth factor. So this one is a growth factor, another chemical that gets released, but this time it's being released from the endothelial lining. So it's really getting released from the lining of the blood vessel. And again, this is just going to help that vessel to repair itself. And then finally is something called fibrinolysis. So the term lysis means to break apart. So fibrinolysis literally means to break apart the fibrin mesh, that little brown spider web looking structure. So fibrinolysis is a process where the clot gets removed after the vessel has been healed. It's no longer needed. Usually this will happen about 2 days after the clot was formed, and it continues for a few more. How fibrinolysis works is plasminogen is activated to form plasmin. And plasmin is a fibrin digesting enzyme. So it's going to help to break down that fibrin, break it apart. Plasminogen is something that we find, and it remains inactive until tissue plasminogen activator gets secreted. Okay, so I want you to think about that. So plasminogen is found in your whole body, and it is in an inactive form, because otherwise it would go around just breaking down clots. We don't want that. Tissue plasminogen activator gets secreted by the endothelial cells, so the lining of your blood vessel, in the presence of a blood clot. So those cells, once that blood clot has done its job and those cells say, okay, we can get rid of it now, they release tissue plasminogen activator. That is going to activate the plasminogen right there by the clot. So this is going to ensure that the plasmin is confined to the clot that needs to be removed. Okay. That way you're not breaking down clots in other areas where you're not ready to break them down yet. Tissue plasminogen activator is also something that they can administer to stroke patients. So if someone's had a stroke, for example, it is time sensitive, so it has to be administered within several hours after having a stroke, but they can administer tissue plasminogen activator to you so that you can break down that clot a little faster and restore blood flow to the areas of the brain. Now, the last thing I want to talk about, we've talked about your blood clotting. We've gone through the 3 big steps. We've also talked about clot retraction and fibrinolysis. So the very last thing in this video that I want to walk you through are just some disorders of blood clotting, of hemostasis. So we kind of divide these up into 2 big categories. One are thromboembolic disorders. This is when you form a blood clot in the wrong place. In an area you don't need it. And the other are bleeding disorders. And this is when someone is unable to form a clot when they do need it. Okay, so hemophilia, for example, would be a bleeding disorder. So let's walk through just a few examples of these. We're going to start with those thromboembolic conditions. So first off, let's talk about what that term thrombus means. A thrombus is a clot that develops and persists in an unbroken blood vessel. Okay, that's the key, unbroken. It's a healthy blood vessel. It's not torn. There's no reason to have a clot there, but the clot forms and it stays. This can block circulation and it can lead to tissue death in that area if the clot is large enough. Now, a thrombus is dangerous because if a thrombus were to break free from that area, now it's moving around the body. It's moving through the bloodstream. And that is like a ticking time bomb. And we call that an embolus. An embolus is a freely floating thrombus. It's just moving around, freely floating blood clot. An embolus that obstructs a vessel is called an embolism. So examples would be like pulmonary embolisms. That's where that blood clot gets lodged in one of the small vessels in the lungs, and it prevents you from being able to exchange gases. Pulmonary embolisms are usually fatal. Cerebral emboli or embolism. This is a blood clot that lodges in one of the vessels supplying your nervous tissue. We know that nervous tissue has a very high metabolic rate. It needs oxygen. So if you block blood flow to an area, there will be deficits. Now, the risk factors for these thromboembolic conditions, one is atherosclerosis or inflammation. Atherosclerosis, I always think of it as sort of like the plaque that builds up on your teeth that the dental hygienist kind of scrapes off your teeth when you go twice a year. Atherosclerosis builds up inside of your vessels, and it's sort of like this hard, sticky substance. Remember, normally your vessels are nice and smooth inside. So if you have atherosclerosis and you have this hard, sticky substance inside, it's really easy for platelets to stick to it. They stick to it, they release chemicals, you get more platelets, and you basically form a platelet plug, and then you start forming a blood clot. So the risk factor for forming a thrombus or having an embolism would be atherosclerosis. Also, slowly flowing blood or blood stasis from immobility. So people who stand for long periods of time for work, if you stand in one spot, think like surgeons doing 14, 15-hour surgeries. They're standing in one spot, they're not really moving. Factory workers standing in one spot, not really moving. Or people who sit a lot, they're very sedentary, you're not moving. And what's happening is that blood, when you're not moving, it pools in your veins, it pools in those vessels. And if the blood is allowed to sort of sit and pool, it's like a perfect storm, because what's going to happen is all those clotting factors end up being present all at once in that pool of blood, and that's going to allow a clot to form. Normally, when your blood is circulating and moving, you don't have all those clotting factors at once on accident, okay? Now, we do have some anticoagulant drugs. You know, I mentioned that term anticoagulant. And again, these are things like aspirin, heparin, warfarin, dabigatran, Brilinta. These are all anticoagulants. A low dose aspirin, which is sometimes called a baby aspirin, can reduce your risk of heart attack by 50%. I say that with caution. That is if you've already had a heart attack. If you've had one heart attack, then taking a low dose aspirin can reduce your risk of a second by 50%. Heparin is used a lot of times for preoperative cardiac care, or after someone has had heart surgery, they'll be on heparin. Warfarin is used for people prone to atrial fibrillation. Other anticoagulant drugs would be things like dabigatran. This inhibits thrombin. Remember, that's part of one of those steps in our blood clotting, one of those 3 phases. And then Brilinta. Brilinta actually prevents platelets from sticking together, so you can't actually form that platelet plug. Okay, so those are our different anticoagulant drugs. Now, I also wanted to mention bleeding disorders. So we have disorders where your blood clots too easily, right? Like a thrombus or an embolus. We also have disorders where your blood doesn't clot when you need it to. Those are bleeding disorders. And one example is something called thrombocytopenia. The term, remember, penia means poverty. We've seen that term before in this chapter. This is a deficient number of circulating platelets. If you don't have enough platelets, you can't form a platelet plug and your blood can't clot. A lot of times people don't realize that you have teeny tiny capillaries. They're microscopic, and so they break very easily. And normally you would never even know unless it's in an area where you have very thin skin. And areas where you have thin skin, where you might be able to see the hemorrhaging, the blood pooling in an area because of a broken vessel, would be your eyelids. So you can see this image here, you can see on the eyelids, this is a condition called petechia. So you can see those capillaries have broken, and this individual is bleeding out from those capillaries. This would be a bleeding disorder. This can be from, and you see little tiny dots. So that's how we know. Normally, again, if your skin is really thick, you're not going to notice it. But because your skin is so thin in the eyelids, you see that. This can be caused by the suppression of your red bone marrow or destruction of red bone marrow. So maybe from cancer or radiation or different drugs. Again, remember, your red bone marrow makes all your formed elements, including your platelets. So if you have a problem with your red bone marrow, and you're not making enough platelets, you can't clot your blood. Okay, so you'll see hemorrhaging from those tiny little capillaries. The platelet count for someone with thrombocytopenia becomes very low, down below 50,000. Remember, somewhere between 150,000 and 400,000 is normal. This is typically treated with a transfusion of concentrated platelets. Another bleeding disorder is one called hemophilia. This is a hereditary disorder, and it's actually caused by a lack of clotting factors. So it's a genetic disorder, causes you not to produce those proteins, those clotting factors that you need. If you don't, even if you're only missing one clotting factor, you can't clot your blood. So the symptoms include prolonged bleeding. Again, remember all those tiny little capillaries in your body that are microscopic that tear so easily. Normally you replace that, you fix it, you form that platelet plug, you never even know it was broken. But in someone with a bleeding disorder like hemophilia, they can't fix that. So it's prolonged bleeding, internal bleeding, especially in the joint cavities. So a lot of bleeding in the joint cavities. You can see the image here, that's the knee. You can see how swollen it is. This is typically treated sometimes with plasma transfusions, or if they know the clotting factor that you're missing, they can treat you with the missing clotting factors. And that is probably preferable than giving you plasma transfusions. Blood plasma, donated plasma, not only would contain the clotting factor, but it also could contain infectious diseases. So HIV, hepatitis. Now, donors are always screened for that, but there is always a risk of a bloodborne pathogen when you get a transfusion of someone else's blood. And so, you know, just to veer off topic a smidge, so this is when HIV kind of first started making a lot of headlines in the United States in the late 70s, early 80s. A lot of people who ended up becoming HIV positive and dying from AIDS were hemophiliacs. So people who were getting blood transfusions of infected blood, and they had no idea. So again, this is why getting injections of the clotting factors is preferable. Now, I know I just mentioned blood transfusions, especially in talking about hemophilia. People can get whole blood transfusions. This is if you've lost a substantial amount of blood, they'll have to give you whole blood back. And we're going to talk about blood groups and blood types and how to make sure that you don't have a transfusion reaction in the next video. But you would get whole blood, which includes plasma, red blood cells, white blood cells, and platelets if you've lost your own blood. You can also get packed red blood cells. So this is going to be where it's basically just red blood cells, plasma, white blood cells, those have been removed. This is going to help to restore oxygen carrying capacity. But remember, giving packed red blood cells also means that you're going to change the viscosity of the blood. And then also, you know, like I mentioned, if they give you a blood type that does not match yours, you can have a transfusion reaction, and those can be fatal. So that'll be what we'll talk about in the next video.